name is Shannon. I'm one of the veterinary surgeons here at Parkvets. I'd like to speak to you a little bit today about flea and worm prevention in our cats. With spring fast approaching and the weather warming up, we are finding that this time of year we're going to have more of a problem with parasites. That's mostly going to be seen with the fleas and the worms, so it is important that we have a protection plan made for your pet. We can protect your pet from parasites in a number of different ways. This is something best discussed with your veterinary surgeon so as to make the right choice based on what your pet's exposure will be in their environment. For routine protection of our pets, we need to have them on a broad-spectrum worming and flea treatment program. There are several products that we routinely recommend. This is not an exhaustive list, but one product called Broadline is able to protect your pet against fleas and worms and ticks. So this is quite a preferred product for many people. It is an all-in-one, once-a-month liquid that goes on the skin of the back of the neck. It is something you can apply at home. Another product that we routinely recommend that is also very effective at doing worms and mites and flea prevention is Advocate. This is also once a month. For the hunting cats, or those that might go into a hunting environment, we would need to and recommend that we top up once every 3 to 6 months, based on how big a hunter they are, with an additional worming product. So for worming, where you need to top up to make sure you have cover for the tapeworm, which again is at a higher risk for those cats that will be hunting, we commonly would recommend a worming tablet. One of the choices would be something like Drontal, or for those cats that you can't manage a tablet with or can't reliably manage a tablet, there is a spot-on product called Profender, and this is also effective to be done once every 3 months. Some cats may require a different approach to treatment for fleas, and for those that perhaps can't cope with a spot-on treatment or their exposure is a little different, and again, this is something you can speak to your veterinary surgeon about. There is an injectable called Program, which can be injected once every 6 months. This doesn't kill the fleas, but it works as a flea birth control effectively, so that it should be able to stop populating your home with the flea larvae in the carpet. There's another option that oftentimes we need to use if you are unlucky enough to be experiencing a flea problem in your home, and that's a spray, and the spray is used to spray the floors and any of the soft furnishings to kill off the larvae and any flea eggs that are living in that environment. Okay, so I'm going to demonstrate how to apply the worming flea treatment, which is in the form of Broadline today for Roxy. Roxy's experience is predominantly a house cat, but she does go outside, and in the warmer weather she has been known to bring home the odd vole. So I do want to ensure that she has not just coverage for the flea treatment, but also the worming protection, which is why I'm choosing Broadline for her today. Broadline, you just open the pipette that it comes in. It looks a bit like a syringe, but there's no injection. So we take the cap off of this, and as you can see, it's just a simple syringe, and we part the fur on the back of their neck. In a short-haired animal, you may be able to not part so easily, but you'll just do the best that you can, because it's important that the product does go in contact with the skin. I choose to do it on the back of the neck, between where the collar lies and where the ears are, because I know Roxy can't turn around and lick that off. So once the application has been applied, the medicine will be absorbed into the skin, usually within about 2 hours. So we do recommend that you do the application in the evening. That way it will have been absorbed by the time the morning comes. It's just more convenient that way. And then it's cuddle time. That's it.